Picture waking up tomorrow and feeling genuinely refreshed. You open your eyes and realize you slept straight through the night. No sudden urgency, no getting up, no lying there frustrated because you can't drift back off. You have real energy again, enough to play with your grandkids, tend your garden, or simply sit with your morning coffee and actually enjoy it. For many adults over 60, that kind of night feels almost unreal. Sleep can start to feel like a constant fight. But here's something you need to hear. Today, it doesn't have to stay that way. Your body can still change and it can still recover no matter your age. In this video, I'm going to guide you through a gentle, specific routine. It's not just about getting some movement in. It's about sending a clear signal to your nervous system that you are safe and it's time to rest. We'll go through 5 simple movements you can do right on your bed or seated in a sturdy chair. And stay with me until the very end, because after the exercises, I'll share a bonus protocol with 3 powerful habits, including the well-known 3-21 rule. I'll explain why waking up at night happens so often, and how a small adjustment to your evening routine can help stop those repeated bathroom trips. There's also a little-known connection between your legs and your bladder that almost no one talks about, and today we're going to address it together. So, get comfortable, take a slow, deep breath, and let's start rebuilding your sleep. Exercise number 4, the single knee hug. Now we move into exercise number 4, the single knee hug. This is a beautiful movement for easing tightness in the hips and the lower back. You may be thinking, Dr. Thompson, what does my back have to do with sleep? More than you might realize. When the lower back stays tight, it can irritate and compress the nerves that travel toward the pelvic area. That tension also keeps the body in a quiet, constant stress state. And when your system feels stressed, deep sleep becomes much harder to reach. Lie on your back. If a pillow under your head helps you relax, go ahead and use it. Extend your left leg long on the bed. Then slowly and gently draw your right knee up toward your chest. Wrap your hands around your shin just below the knee. If that feels uncomfortable, or you can't reach hold behind the thigh instead, which is often kinder to the knees. Now, bring the knee a little closer softly without forcing. You should feel a mild stretch through the lower back and into the right glute. Stay there for a moment. Breathe into the tight area. Imagine the breath melting the tension around the spine. Hold for a few seconds, then lower the leg back down with control. Now, switch sides. Bring the left knee in. Hold behind the thigh, if that's better for you. Gently draw it toward your chest. If you want, close your eyes and notice the release through the back. We'll alternate slowly, right knee in hug release, left knee in hug release. Move as if you're in water, calm and unhurried. This is your signal to the nervous system that the day is done. There's nowhere you need to go right now. Nothing you need to solve. Just this moment of care. And if you've had a hip replacement or you feel hip discomfort, keep it very gentle and only move within a comfortable range. The goal is never pain. The goal is relief. Exercise number 3, the gentle hamstring. Glide. Let's continue with exercise number 3, the gentle hamstring glide. Tight hamstrings and the large muscles along the back of the thighs are extremely common in older adults. Sitting for long periods shortens them over time, and when they tighten, they can tug on the pelvis in a way that changes its position and may increase pressure around the bladder. When we lengthen these muscles gently, we create more ease through the pelvis and help the entire lower body relax. You can stay lying down for this one. Bend your left knee and keep your left foot flat on the bed to support and protect your lower back. Now, lift your right leg toward the ceiling. It does not need to be perfectly straight. A soft bend in the knee is completely fine. Place your hands behind the thigh for support. Then gently reach your heel upward as if you're trying to tap a button on the ceiling with your heel. You'll feel a stretch down the back of the leg. Hold for a moment, then allow the knee to soften again. Now, repeat on the same side. Reach the heel, up, feel the stretch, then relax. This is a light pulsing motion. We're not forcing a long, rigid hold. We're gliding the muscle and the nerve in a controlled, comfortable way. Reach then, breathe out and release. One more time, reach and relax. Now, switch legs. Place the right foot flat on the bed with the knee bent. Lift the left leg up. Support behind the thigh. Then extend the left heel toward the ceiling. Notice that stretch along the back of the leg. It may feel stiff at first, like a rusty hinge. But with each repetition, imagine that hinge loosening. The movement becomes smoother. It becomes easier. Extend and relax. Extend and relax. If you notice a slight trembling or vibration in the leg, that's okay. It's simply the muscle working and letting go. But if you feel sharp pain, lower the leg a little and reduce the range. We're looking for a gentle, good stretch sensation, never anything sharp or alarming. Exercise number 2, the reclined butterfly. We're nearing the end of the movement portion, and exercise number 2 is one of my favorites. It's called the reclined butterfly, and it's meant to gently open the hips and soften the pelvic floor. Many people don't realize how much stress they store in the pelvic floor. Without noticing, they clench those muscles throughout the day. That constant tension can imitate the sensation of needing to urinate, and it can be enough to wake you during the night. So, here we're practicing the skill of releasing. Lie on your back, bend your knees, and bring the soles of your feet together so they touch. Then slowly allow your knees to drop outward to the sides, like a book opening. If that feels intense, support yourself. Place pillows under your knees, and I actually encourage you to do that. The goal is not a deep stretch. The goal is deep relaxation. If you're fighting to hold your legs up, your nervous system can't settle. So let the cushions hold you and let your body release. Now, rest your hands on your belly and close your eyes. Let gravity do the work. Notice the inner thighs gently lengthening and the hips softly opening. As you stay here, bring your attention to your breathing. Inhale and feel your hands rise with your belly. Exhale and feel them fall. With each exhale, imagine tension draining from your hips, melting down into the mattress. Silently tell yourself, I am letting go. This position is remarkably calming for the nervous system. It helps shift you out of fight or flight and into rest and digest, the state where recovery happens and deep sleep becomes possible. Take a few more slow breaths here. Enjoy the stillness. You deserve this quiet moment. Before we move into the final, most important exercise and the bonus habits, I'd love to hear from you. We have a wonderful community watching from all over the world. Pause for a second and leave a comment telling us where you're watching from. Are you in Texas, London, Sydney, or somewhere else? And if any of these movements felt challenging, or you have a specific health question, ask in the comments. I read them, and I do my best to respond to as many as I can. We're doing this together, and I want to help you succeed. Exercise number 1, diaphragmatic breathing with leg elevation. We've reached exercise number 1, the final piece of our physical routine, and it sets you up perfectly for the habits we're about to cover. This is diaphragmatic breathing with leg elevation. Earlier, we talked about fluid collecting in the legs during the day. This is one of the most effective ways to help that fluid move. You have a couple of simple options. You can stack 2 or 3 pillows at the foot of the bed and rest your calves on them. Or if it feels comfortable for you, scoot near a wall and place your legs up the wall. The goal is to position your feet higher than your heart. Once your legs are elevated, gravity starts doing the heavy lifting. It encourages blood and lymph to flow out of the feet and ankles and return toward the center of the body to be processed. Now, we add the powerful piece, breathing. Place one hand on your chest and the other on your belly. Inhale slowly through your nose for a count of 4. 1, 2, 3, 4. Feel the belly rise under your hand while the chest stays mostly quiet. Hold the breath for 2 counts, then exhale through your mouth as if you're blowing through a straw for a count of 6. Feel the belly soften and fall. Let's repeat. Breathe into the belly as if you're filling a balloon. Pause, then release the air slowly and completely. This style of breathing stimulates the vagus nerve, one of the body's main relaxation pathways. Combined with elevating the legs, it sends a clear message to your system that it's safe to power down. Practice this for 2 to 3 minutes each night. It helps move excess fluid, quiets the mind, and supports one final calmer bladder, emptying before sleep. Well done finishing the exercises. You've prepared your body in a very practical way. Now, as promised, we're going to look at the hidden factors, the everyday habits that may be disrupting your sleep without you realizing it. Here are 3 practical habits to help you fall asleep sooner and stay asleep longer. Life hack number 1. The 3-2-1 rule. If you remember only one idea from today, make it this. The 3-21 rule is a simple countdown that sets your body up for deeper, steadier sleep. 3 hours before bed, stop eating. Your body can't fully rest while it's busy digesting. A late meal or nighttime snack keeps your metabolism switched on, raises body temperature, and pulls energy toward digestion when it should be shifting into recovery. As tempting as late snacking is, try to close the kitchen 3 hours before you plan to sleep. 2 hours before bed, stop drinking fluids. This is essential if you're waking up to use the bathroom. Give your kidneys and bladder a break by pausing water, tea, and juice 2 hours before bedtime. You might be thinking, Dr. Thompson, what about my medication? That's an exception. A small sip to take pills is perfectly fine. The goal is simply to avoid full glasses of liquid late in the evening. And if 2 hours feels too hard at first, ease into it. Start with 1 hour. Next week, try 90 minutes. Then work up to the full 2-hour mark. Your bladder often responds quickly once the routine becomes consistent. 1 hour before bed, do the routine. Use the movements you just learned, ideally about 1 hour before sleep. That timing matters because the routine does 2 important things. It relaxes the pelvic floor and leg muscles, lowering physical tension. And it helps move the fluid out of the legs so your body can process it while you're still awake. That gives you time to use the bathroom one last time, right before lights out, so you go to bed with an empty bladder. If you wait until you're already in bed for that fluid shift to happen, your bladder may fill during sleep and pull you awake around 2 a.m. If you can't fit all 5 exercises in at minimum, do exercise number 5, the ankle pumps, and exercise number 4, the knee hugs. Those are the most important for the drainage effect. Life hack number 2, set the atmosphere. Your environment matters more than people think, especially during that final hour. Choose calming audio, something slow and instrumental or gentle nature. Sounds like rain or ocean waves. It gives the mind something soft to focus on and reduces spiraling thoughts. Then adjust your lighting. Bright white overhead lights tell the brain it's daytime and can suppress melatonin. Turn off the strong ceiling lights and use a small lamp with a warm yellow tone. Aim for dim and cozy, like sunset. That visual signal helps your biology understand the day is winding down. Life hack number 3, the sleep diary. This one is for the curious minds. Keep a simple journal because sleep rarely happens randomly. Tracking helps you discover what helps you and what hurts you. After a rough night, write it down, but go beyond slept badly. Be a detective. What happened that day? Spicy dinner? A stressful conversation? A scary movie? Coffee after lunch? Small details often explain big changes. And pay special attention to the good nights. When you wake up feeling unusually rested, record it. What did you do differently? Did you skip afternoon caffeine? Get sunlight during the day? Complete the routine. Spending time on a calming hobby that lowered stress. When you learn your own patterns, you stop guessing. You start making choices based on what your body clearly responds to. And that's when you become the one in control. Before we end, I want you to remember, this better sleep after 60 isn't about forcing your body to try harder. It's about giving your nervous system the right signals at the right time. When you follow the 3-2-1 rule, calm your environment, and track what truly affects you, you stop fighting your nights and start guiding them. Tonight, don't try to change everything at once. Pick one step and commit to it. Close the kitchen 3 hours before bed. Pause fluids 2 hours before. Do the gentle routine 1 hour before. Then take that final bathroom trip, turn the lights low, and let your body do what it was designed to do, rest and repair. And if you want to make this a real turning point, keep your sleep diary for just 7 days. In 1 week, you'll start seeing patterns you can actually use so you can sleep longer, wake up less, and feel like yourself again in the morning. If this video helped you, please tap the like button, subscribe to the channel, and turn on the notification bell so you don't miss our next videos. We share simple science-informed routines for adults over 60 so you can sleep deeper, move easier, and stay independent. Thank you for watching, and I'll see you in the next video.